Hi, this is James Donnelly with Safe Haven Insurance, your Medicare and health insurance safe place. So this is my podcast. It originally started out as Medicare discussions, which it still is, but it really turned into something of a resource for seniors and aging adults. I've interviewed some really great guests, and they're just putting out a ton of information for our seniors about miscellaneous topics that you guys would be confronted with. I'm here today with my friend Pete Ciccone. Did I say it right? Pete Ciccone? Ciccone. He is a founder of All Saver RX and Metaford Global. He sponsors this show. As you can see on the bottom, there's two links. With a discount code. If you want, check out the website. You could save some money on prescriptions, but we're going to get into that. If you like the content I'm putting out, please like and subscribe. I know I never really asked that, but it definitely means a lot to us here. Like the video, subscribe to the channel. You get some exclusive content. It's really a good thing.
Like, share, and subscribe.
Like, share, and subscribe. Coming from a true video,
true podcaster.
True podcaster. So Pete,
yes,
thank you for coming on the show. I appreciate it. Tell us a little bit about you, how you started. How'd you get started in this?
Okay, my brother and I ran a company called the New York RX Card. We had a product from United Networks of America, and that program has, we accepted a severance package and a buyout, if you will. Okay. And we came up with a new program, All Save RX. It does the same thing. It's a prescription discount program that allows people who can't afford one particular prescription, or a prescription's not covered, or they find themselves in a lapse, but something's not covered. They need it. When they're at the pharmacy, they use the card to get a discount. It's really that simple. Does
it work in conjunction with the prescription drug coverage?
No, it's one or the other.
It's one or the other.
Okay. What you're asking, I think, is can they double dip?
Yes.
No, that's illegal. Okay. But if they have insurance and one prescription's not covered, which happens
all the time,
they can use the card and buy that one prescription. And the reason seniors are so important to our program is they have things, and you know it better than I do, like the donut hole, and they're buying things out of their program all the time. And even if they're on Medicare, there's certain things that are just not covered. And certain name brands the doctor wants them to have that they don't, he doesn't want or she doesn't want the generic.
I see it actually with my clients. They'll say, oh no, I don't like the generic. It doesn't work well for me. I prefer the brand name. My mother also, she's on Synthroid. Okay. She refuses to go on the generic. So she pays a little extra for the Synthroid. I know my aunt, my wife's aunt, she buys a lot of prescriptions overseas because her insurance doesn't cover those brand names, or the cost is so much for the brand names, even with the insurance. So it's just cheaper to go overseas.
Well, you mentioned that, and at All Save RX, if somebody goes to, and I've said this to you a million times, allsaverx.com, you go to the website, you drop down to the Metaford Global tab.
Okay.
You type in the prescription that you want, and you can match it up with the dosage, the proper dosage that you're looking for. And you have the option to buy things overseas.
Nice.
Our program at Metaford Global only represents tier 1 countries. And by tier 1, that are those countries that have the same level of care put into their prescriptions as does the United States. Countries like the United Kingdom, Australia, New Zealand, India, Canada is another country. Countries with tier 1 pharmaceutical programs. So you know what you're getting, and you can trust the quality. And the reason why those countries work so well, and why overseas many of the prescriptions are less expensive, is because they have subsidized medication in those countries, but they allow the pharmaceutical companies there to sell outside of the market because they understand there is a profit motive. Okay. And it's not simple. They allow a certain amount to be sold outside their own market.
Got it.
Even though they're subsidizing. And we have access to those markets, which are excellent. The prices, they drop things down considerably. One of the ones, Eliquis, which I believe is, for seniors, the most prescribed medication out there.
I see it a lot.
We had a 3-month supply for about $300, $280.
Wow.
Versus $500, which was the going rate. I saw everything $400 or $500. We were at $280, then it dropped to $218 at one point.
So I had a guest on the show last week, and she spoke about Symbicort.
Okay.
That it wasn't covered, and it was costing her $350 a month for the Symbicort. So she could go on your website, either All Save RX, and then she could click on the Metaphor Global link and see which one is less expensive.
Well, what I do, I've gotten props here too. On my business cards, on the business cards, I have the QR code on the back.
Oh, awesome.
And I send people right to the website. So give her the card.
Yeah, definitely. I definitely will.
Right there. I mean, that way, I don't know how many times I go for one website and can't find the darn thing for whatever reason. But the QR code, that was our marketing hack. Put it right on.
I love it. Yeah.
Right on the back of the business card. And she can drop down and I'll talk her through it.
Okay.
Metaphor Global and Symbicort. And I can get your price before we leave today.
And there was another one also that you spoke about. I'm not sure. What I'm curious about, and I'm not sure. I don't know the answer to this actually. And I was going to Google it before the show. So let's say a senior is on Medicare.
Okay.
They have a drug plan or they're on a Medicare Advantage plan, and this prescription is not covered in this plan, or it's a name brand or a premium drug, and they have to pay full price for it, right? So they pay full price for it, and then it ends up getting them into the donut hole and then into catastrophic because drugs are expensive, right? So if they were to go to Metaphor Global or All Saver RX, does that count towards the Medicare donut hole to get them into catastrophic?
No, not the way you've I mean, they could take the invoice and go back to the Medicare people, say, I actually bought it. They'd have to
it's truly so out of pocket.
It's out of pocket. Yes. But this is also out of the program.
Okay.
So in the way it normally works is they pay the cash price they're asked to pay, and it gets recorded automatically that they spent it. Here they would have to show that they made the purchase.
But it is a possibility.
It's a possibility. The best time the donut hole applies is when it's October, November. There's no way they're going to
catastrophic.
Yeah, there's no way they're going to make it, and then it gets reset in January. So for the next 2 months or so, they're just going to have to pay cash. When they're in that situation, use the card, use the Metaphor Global.
Got it.
Or
if there's no shot that you're going to go catastrophic, then, because ultimately, what your drug costs are.
Yeah.
I'm able to, when I sit down with my clients, I'm able to tell them month by month what their out-of-pocket prescription costs are going to be.
Okay.
And, the whole thing is with Medicare is, like, for instance, I had a senior the other day. He came to one of my seminars, and he came in. He scheduled an appointment right before his birthday, and he came in, and I said, don't do anything until we speak, because he was still working and he had group coverage. Don't do anything. But his out-of-pocket cost for the group coverage was about $675 a month.
Okay.
So he looks at it and says, wow, I could pay $170, $470 and go on a Medicare Advantage plan, and my out-of-pocket cost is $174. So I'm saving, in essence, $500 a month, right?
Yeah, it's a nice car.
It's a car payment, right? So he came in. I said, don't do anything until we sit down and figure everything out. So he came in and he said, James, I did it. I got my red, white, and blue card. And I said, why did you do that? I said, don't do it. I wanted to get a jump start. I said, we have to go over everything, your drugs. We have to go over everything. No, I'm good. I'm going to save $500 a month. I said, okay. So he came in. We sat down. We went over all his drug costs. It was going to cost him. He would have to pay the $5,400. He was on a lot of medication.
Okay.
He was have to pay the $5,400, go into the donut hole. His out-of-pocket cost was going to be about $8,000 a year for drugs.
Did he undo what he did?
He did. He had to go down to Social Security, and he had to to freeze his Part B because he
Okay.
was still eligible for work, for group coverage. But that's one thing that I do is when you're approaching 65
Sure.
and you're on group coverage and you're still working, formularies are different. People don't realize that. They're like, oh, my drugs, they cost me $20 a month for my drugs. And then the Medicare formulary is completely different. You have to remember because people are paying such a high premium, whether they are or their employers are paying such a high premium for that group coverage. They make it attractive and it covers a lot more drugs than Medicare.
People ask me about formularies all the time.
Yeah.
And I just say, nobody knows what they are. I mean, you might know one formulary, but if you knew how, I always tell people, if I knew how they calculated formularies, trust me, I'd be doing something else.
Yeah.
I'd be decoding for NASA or something
Yes.
of that nature.
And that's another thing. The formularies change every year with Medicare. So it's so important to sit down with somebody like me or another trusted Medicare advisor just to make sure that, you're on the best plan because the plans change and the formularies change. So you never know what your drug costs are going to be the following year unless you sit down with somebody.
And if I ask you or you ask me, explain the reason for the changes and how these were calculated and who came up with this idea, you and I have no idea. Yeah, we can't give an honest answer because we don't know.
Yeah.
And I think we agree they're intentionally difficult so that people can't just figure them out quickly. But they're not done, I don't believe, for the betterment of, we really want to make life easier for our seniors. I don't think that's the motivation. I wish I thought it was. I don't. And but I do know our program works.
That's amazing.
That's why I do that. I can't do the other thing and change the formulary so that they make sense for everyone. But I can do.
Well, no one could really.
Yeah.
The only thing we could do is just to evaluate that your drugs that you're on, and figure out if you're on the best plan because they do change. And there's plans as low here in New York, $370 a month, all the way up to $179. And a lot of times those lower price premiums, people think like, oh, my drugs aren't going to be covered on those. And my drug costs are going to be more expensive, but it's not. I saved so many people money this last AEP because they were on a plan. Everyone thinks they're good, Pete. Everyone thinks it's like when you walk into Best Buy and you're like, I'm good. I don't need help. But they're on the same plan that they were on since they got on Medicare. The plan's changed 100 times. The premium's gone up. The formulary's changed. And they don't know if they're good. They're just assuming that they're good because people don't like change. People are fearful of it. But it's so important to sit down with somebody like me or another advisor just to make sure that you are good because that's what we do every day.
No. And I think with Medicare in particular, the things are kept confusing intentionally.
Oh, yeah, definitely.
And I don't understand that logic. I'm sure some bureaucrat could explain it to me, but I've seen too much of it. I've seen too many. I've seen horror stories. I mean, I've seen a fraction of what you've seen. And the horror stories I've seen, I've gotten calls from 80-year-old women who don't, they have to choose between food and medication. It's a real problem.
Oh, yeah.
And it doesn't have to be. And I think some of the other countries haven't figured out. The one thing I'll say about the medication in the United States, it's where all the innovation comes from. I have more to, it's when you look at the pharmaceutical companies, the innovation comes from the U.S. where there is a profit motive. So there is a benefit to it. Does it have to be 800% profit? If the thing costs you 60 cents to manufacture and you're selling it for $300.
Yeah. Why is one drug, let's say $1,000 in the United States, but in Canada, you could get it for 300 or 200.
Well, that's more the subsidy of what Canada is paying or New Zealand. Unfortunately between us.
Well, not really between us.
No, but if we start talking about pharmaceuticals, that's going to delve immediately into politics.
Yeah.
Because, if you want, and there's no need for that. If you want to talk about medication, Canada subsidizes their medication. That's why Metafor Global works.
Okay. We
don't have that in the United States.
Got it.
Our system is I don't want to call it broken, but it's not it doesn't work well either. So broken might be the right word. It's certainly discombobulated and I mean, but if, that's what you do. That's where could they simplify it?
Without any question.
They could simplify it and make it better.
Mm-hmm.
I happen to think there's forces at work that don't allow that and don't want that and see, what would I do if they did that? And
we could totally spin off in so many different directions with this.
That's where I'm
and I'm trying not to say what's really on my mind because, and I get frustrated with Social Security when everyone's like, oh, who knows if Gen X's are going to have Social Security because they might run out. How is it possible that we're running out? It's because the money wasn't allocated and left where it was supposed to be left.
Absolutely.
And they went into that little pool and they used the money elsewhere.
And then, and neither one of us are CPA or a lawyer, or financial advisor.
Mm-hmm.
But there are financial advisors, they're split on this. Some say when you get to a certain age, on paper, you want to be broke. Even though you own everything, put it in one of your kids' names or put them as the beneficiary on it so certainly if you have cash in the bank, you put one of your children's name on the account. So if and when you pass, he or she can just get that money without having to pay tax on it. There are plans like that, but on paper, if you die broke, then you're eligible for Medicaid and Medicare and some of the programs that you have to qualify for.
Well, they say actually, believe it or not, 95% of the population could actually seniors could get on Medicaid if they structure things properly.
But I spoke to a financial advisor I'm very close to who hates that idea for no other reason than he said there are better ways of doing it. You work hard your whole life to amass a fortune. You don't want to have to give it up just so you can qualify for the state program. Because when you're on the state program, and you know this well, you're only going to get what the state gives you.
Yes.
Versus what you can really afford.
Correct.
And we can, again, spend that in a million different ways.
We could spend that. And I mean, and if you're talking about like in-home care or nursing home care, I mean, the cost associated with either one of those could be astronomical.
Crazy.
So, and I think that's why a lot of people fall onto Medicaid to subsidize the in-home care, the nursing home care. And I mean, let's be real. I know my grandparents and my parents, when we spoke to them about long-term care insurance throughout the years, it's, I can't afford it. I can't afford it. I can't afford it. I can't afford it. And now, okay. So my two grandparents passed away. They didn't need it. So that would have been a waste of money, right? Sure. My grandfather passed away in the hospital after surgery. My grandmother is now bedridden, and we have in-home care for her. So the cost associated with that is astronomical. So if we would have had it for my other three grandparents, it would have been a waste of money because with long-term care, it's use it or lose it. And then if we would have had it for my grandmother, it would have made sense. So, but there's other ways to structure it now. Yeah. You could do single premium IULs. You could do IULs with a long-term care rider. There's other ways to structure long-term care. And
you can tie it into life insurance.
You can tie it into life insurance. You can tie it into annuities. Yeah. So this way here, if you don't use it, it gets passed on to your beneficiaries.
For what you need.
So that's something that people really need to consider. I have a family friend who was a big long-term care insurance guy, and he used every cent of it. He really did. As he was aging, he needed help around the house, so he brought in home care just to help. He had aides help him, drive him. It was very convenient for him, so it's great. But it's all about planning for the future.
Planning for the future.
And now with, healthcare costs the way they are, especially prescription drug costs, there are options. And that's what we're here to tell you about is our options, Pete's options. There's links below, there's QR codes, scan them, put in our discount code, check them out. Definitely.
It's like there are always options. Whatever dilemma you're faced with, there's an option. Okay. And, when it comes to prescriptions, I always tell people, especially if it's a high-end, Taylor drug, I call it, go to the manufacturer first. Go Google the manufacturer, see what's available. A lot of times, and I get nothing for that, but it's a lot of times they would rather have the 75-year-old woman who took their miracle drug and who couldn't walk into the hospital room, and now she's dancing. They want that story.
Yeah.
And, yes, the list price might be $1,500 because it's brand new. They've also spent $1 billion in research and in development. So they have a business model there too. They didn't just come up a lot of times, as much as you want to blame them, they didn't just come up with the number out of picked a number out of the sky. And the reason why the foreign countries have a lower price is because they've subsidized it. They've paid the proper amount or the amount that was charged, but they're able to give it to their citizenry for less because they've subsidized it. But that manufacturer will give, a $1,500 drug for $100 or for free because they want to prove that it works. And like I said, they want the 75-year-old woman who couldn't walk into the place and now she's dancing and she thanks them.
So they have manufacturer direct coupons.
Absolutely.
Yes. So that's step number one. All right.
Yeah.
So obviously you see what it's going to cost through your prescription drug coverage. If that doesn't work or if it's too expensive, go directly to the manufacturer. So that's option number 2, right? And then after that, they go on your website.
Yeah, first option is a manufacturer coupon. Second option, I would say go onto the website, see if you can buy it internationally or from our pharmacy, Elixir, which directly.
Okay.
And
they can get Elixir on that website as well?
They can get Elixir on the website. On the website, you have domestic, you have foreign, you have Price My Prescription, which will take you to your local CVS or wherever and allow you to price it out. But one of the options that will come up is the mail order Elixir. Okay. I have a theory that in 5 years, 25 to 40% of all prescriptions will be mail order. You see it every day. You see more and more pharmacies.
I just saw Rite Aid's. The Rite Aid's closed a bunch of stores, right?
Rite Aid's have closed in New York, probably 40, 50 stores.
Wow.
And the few that are left are on their heels. Yeah. And that was management. That was poorly run company. But Walgreens is closing stores. The supermarkets used to have nice pharmacy stands. A lot of them are closing. And where there used to be a pharmacy, now there's a florist or there's something else because it's all about what makes more money.
Okay.
To how you walk in any supermarket, if there's a pharmacy, one or both pharmacists, if they're not the highest paid people in the place, they're the top 2, top 3. Yeah, both of them are in the top 3 or 4. So that puts so much onto what it costs just for an employee. Second, what are the prescriptions cost? What do the drugs cost to have there? So it's an expensive proposition for them. And if they're not a busy pharmacy, the theory was Mrs. Smith is going to come in, place her prescription, go shopping, pick the prescription up before she left. That doesn't always happen. Yeah. Versus a CVS that people will go there just for their prescription. And it's a mental thing, but it just happens. But CVS, they've got $5 million. Rite Aid, they have $5 million of product on the shelves. So, for them, that's also, a pharmacy is an expensive proposition. The independent pharmacies.
I've noticed a lot more popping up.
Where are you noticing them? In rich neighborhoods, in poor neighborhoods, or
a mixture of both?
They used to, for years, they used to be everywhere. And then for years, they were only in one or the other.
Because what happened was CVS, Rite Aid, Walgreens was moving into a neighborhood and buying out that pharmacy.
Yeah.
That's
initially. Or just putting them out of business.
Or just putting them out of business, yeah.
But in the poor neighborhoods and in the worst neighborhoods, they're there. And in the elite neighborhoods, they're there because they're easier for them to survive in those neighborhoods. It's in the two extremes. You see what's happening. I think some bright people are getting the idea, hey, if I open my shop where Rite Aid is closed, I don't need 20,000 square feet to run my store. I need 2,000
square feet, exactly.
And I can do it. Here's the difference. When you go, I'm a marketing guy. When push comes to shove. When you go into that small store, he'll only have medical stuff. So if you don't have a real medical need, you're not buying anything else off his shelf. And then there's some candy, but it's only prescriptions. CVS, how many times have you gone to a CVS for something not prescription related.
In the middle of the night, I'll run there if we're out of paper for the printer. I'll run there. They have paper. They actually had some ink cartridges there for printers. They have a lot.
You can get your photos developed there. You can get there's certainly milk. That's why the prescription card always works so well.
We run out of ice cream in the middle of the night. That's the first place I'm hitting is Walgreens because they're open 24 hours and I can't deny my wife ice cream.
Well, the New York RX card, when we had it, they would ask us, what's the benefit to CVS? CVS was smart. Their math was simple. The more people who crossed that threshold, the more they sold, the more money they'd make. So if there was an average 30% discount with the card, which there is with this one, average 30%, something normally costs you $100, costs you $70 now. Okay, actually it was 33%. So it went down to $67. Now mom has $33 in her pocket. I'm going to call it monopoly money. She didn't expect to have this discount, this money in her hand. Now the $2 kickball that the kid wanted, I'm a hot shot. I got $33 in my hand. You know she needs milk or cookies in the house. And she's got that $33 to spend. And the CVS understood they'll make as much money on that $33 in other stuff than they will on a $67 prescription because there's so many fees that they have to pay on that $67 they received just to keep them in compliance. That's why they love this.
It's true though. It really is. And then I noticed some of these little not urgent cares, but they have like in CVS, for instance, they have like these little areas where you could.
They do. The minute clinics.
Yeah, the minute clinics. Yes.
But they're finding, and again,
I noticed they open and then closed, and some.
But again, here's the thing: you either got a doctor, a registered nurse, or a PA, or somebody with a medical sort of license. I don't want to say sort of license, but you have one of those three. Somebody, a PA, a doctor, or a registered nurse in that clinic.
Okay.
Again, if the pharmacist is the highest paid person in the clinic, that person's making probably as much as the pharmacist. People have to go there to make it worthwhile. So what they were finding is people aren't going there for their medical advice. They'll go for the prescriptions. And it didn't grow the way they thought it would. So they had to get rid. Now they're eyeglass places. A lot of them have been converted.
And Walgreens partnered with LabCorp, and now you could get your blood work done in a Walgreens instead of going to, which is pretty cool. Did you notice that?
I did not have.
Yeah, so a couple of the Walgreens have like a little area, and it's LabCorp, and they bring you in. You wait outside. They bring you into a room. And they do your blood work for you right there, which is super convenient because
that might work well.
That's been around for a couple of years now.
That might work well. I mean, I've probably passed. I can't tell you the number of Walgreens.
It's not really like it doesn't say LabCorp on the building, but when you go inside, there's definitely a section that is well labeled.
If you're going to get your blood work done, or if you're going for a drug test, or you're going for something of that nature, and you're going to Walgreens, I could see. That's its own business that people will go for that. Once they're in the Walgreens, they're paying Walgreens rent. They're paying them rent to be there. And now you're in the Walgreens. So now, let me get a soda. Let me get, I want a Reese's,
of course.
Or let me buy something while I'm here. It's Father's Day. It's coming up.
So you feel like, the future of prescription drugs is going to be mostly mail order.
I think the mail order will grow exponentially.
Okay. Which makes sense. All the Medicare companies have their own, all the Medicare Advantage plans and prescription drug plans have their own mail order pharmacy.
It's grown exponentially in the last 5 years.
Okay.
I think that trend will continue.
Especially on maintenance drugs. Not so much like you need an antibiotic or something, that's more urgent. But on the maintenance drugs, I could definitely see that.
You and I come from one generation where we hear prescription, we think, go to the store. We're 10 feet from a guy who goes right to his phone first, or goes right on the computer first. You and I are getting to the point where we can check out prices on the computer, where we start to think, well, let me look online first and see what it costs. And that's we're getting to that point. You're probably there before I was. We didn't grow up with that, where Anthony did. That will change, and as our generation becomes more in tune with it, and we've been there. that'll grow. Our parents' generation, no, but as they get older and more people our age, well, let me just go online and I can order it. I don't have to leave work. I don't have to go pick it up. If I order it Tuesday, it's here tomorrow, for crying out loud.
It's crazy.
I can wait a day.
Wow.
And the doctor emails you everything's electronic anyway. He emails you the prescription. You send it right into the Metaphor Global. And if you're going online to do it, and if you're going, let me buy it globally. And
I've been on that website before, and I look for my clients all the time on that website when there's something that's not picked up in the formulary. And it's nice, and it gives you a couple of different options and price points.
And you'll see the different countries pack them differently. So that's where the real benefit, I always tell people. So if you're going to buy a 90-day supply, there might be one for 120, and I always say do price per dose. Don't look at the what's the cost.
Yeah.
Do the price per
Makes
dose.
sense. Yeah.
So, that way you really know what you're paying. Well, you come from the restaurant industry originally. I always tell people, what's your price per serving? Not your price,
of course.
Not even your price per pound. We share that history. What does it cost you? What does the plate cost you? That's what you have to price, not the price per pound. And when you explain that, I don't have to explain that to a restaurant guy, but once your price per dose, so $180 might be cheaper than the other $150 because you got 300 versus 160. And where one was $1 a piece, the other one was really 80 cents a piece.
Yeah.
So
it's really amazing what you and your brother did. So how do they? What's the website again? We're going to put the QR code is up, I believe, on the bottom of the screen.
AllSaveRx.com. 3 words. AllSaveRx. That's not a word. It's just prescriptionrx.com. And one thing we've taken on.
I was just going to ask you about that. Talk to me about Community Care RX. What is that?
This is a private pharmacy that is community-based, but it's not a retail pharmacy at all. They have community partners.
Okay.
They work with nursing homes and group homes where prescriptions are part of the daily life.
Okay.
And the breakdown per person, per prescription is incredible. The amount of care they put into it, the amount of care they put into what they do. It's a private pharmacy looking for community partners.
Okay.
So it's not like, I need some amoxicillin, let me go. Can't do that. I run a group home with 30 people all of whom are on prescriptions of some sort. And we need to have somebody who works with us. Okay. And 24/7 service, delivery, you name it, they do it. And as we were told, say yes, we'll figure it out.
Okay. So if the listeners wanted to get in touch with you regarding that service, who is a good candidate for that? You said nursing homes, rehab facilities.
Yeah, and I'll read right off the brochure. The community
group homes,
resident programs, assisted living and nursing facilities, home care, senior adult care, adult rehab programs, camps. Wow. Camps where, if kids are at a sleepaway camp, you have one nurse, it's easier to have the professionals break. She might do it too. What is this little Joey taking? What is Sally taking? Blah, blah, blah. You might not want that. Or she may get overwhelmed and God forbid something happens.
It's a great idea. Camp season's here now.
Camp season's here.
Okay.
What we're looking for is to build relationships within the community. And what I've been focusing on is assisted living, nursing homes and the like, group homes, places like that where there's 12-month-a-year residents and prescriptions are part of their daily life.
Okay.
And
how do they get in touch with you about this program?
PC, Peter Ciccone, PC at allsaverx.com.
Okay.
Same. It all funnels through to me. So PC at allsaverx.com.
All right, perfect.
And that's it. Thank you.
All right, definitely go on this website, check it out, see if you could save some money with prescription drugs. Well, see how much you could actually save because you will save money. It's just a matter of how much. Thank you so much for being with us. I appreciate it. Thank you.